Welcome back, everybody. We are moving our discussion tonight to what's going on with the officers sworn to serve and protect Connecticut citizens. How is the coronavirus changing policing? Is it changing crime? Joining us via Skype right now is Old Saybrook Police Chief Michael Spera. Chief, thank you very much for joining us. I appreciate it.
You're very welcome. Thank you for the opportunity.
I guess I should say, for the record, you're the chief of the town I live in, so I just want to make sure folks know that.
Proud to have you as a resident.
Well, I appreciate it. It's a wonderful place to live, and it's a great community. But I think right now in Old Saybrook and in communities everywhere, folks are really trying to wrap their heads around what's going on here. What do you see as a chief? What are you hearing from people in town?
Sure. People are certainly nervous, and I think more than ever, they need to rely on their public safety professionals. So we know across this great nation, from sea to shining sea, everyone knows one number to call when they have a critical issue, and that's 911. So we want to make sure that our first responders, police, fire, and EMS, are at the ready to serve the very people we're sworn to protect.
In that role, Chief, have things changed at all? You know, for the men and women in your department, does it change how they interact with the public?
Absolutely. You know, it changes from the ring of the 911 call. So dispatchers and dispatch centers all across Connecticut are asking different types of questions. They're asking if anyone in a home that we're responding to or at an accident scene, does anyone have flu-like symptoms? Has anyone had a fever? Has anyone been around someone that has tested positive for COVID-19? So this is definitely new for us. We're also changing our response guidelines to medical emergencies. So we're not entering convalescent hospitals like we used to. We're scaling back on non-emergent responses and limiting first responder contact, because we also have a concern about the health and well-being of the first responders themselves.
Right. I mean, they're on the front line of this and potentially walking into a situation that wouldn't be good for them. They could then find themselves getting sick.
Correct. And that's what we're really worried about. So as we are the frontline personnel, we want to make sure that police officers, firefighters, EMTs, and paramedics have the proper equipment to protect themselves, because we can't afford public safety to become sick. Because again, when that 911 call rings, we need them to be there for us.
Yeah, that's for sure. What sort of precautions, Chief, are you taking for the officers and the staff to keep them protected? I'm imagining gloves, masks, if you can get them, things like that, perhaps?
Absolutely. So in addition to the regular personal protective equipment, there's a lot of change in our normal operation. We've shut down different areas of our building. We've limited how many people can be in a building at a time, how many police officers are actually sharing a patrol car. We're wearing different uniforms. They're being laundered before the officers leave to go home. So things like that are very, very important to make sure that, again, we maintain the health of not only our police officers, but our firefighters, EMTs, and paramedics all across the great state of Connecticut.
I would imagine in all of that, you probably have a plan in place in the event someone with the department did come down or was diagnosed with coronavirus.
Absolutely. So very early on, public safety chiefs all across the state saw this coming. They put some plans into place. Here in Old Saybrook, all of our officers have been placed in a 3-hour emergency call line. So just in case one of our officers got ill or we had a specific cluster outbreak in Old Saybrook, officers would be at the ready to respond and be here. In Old Saybrook, we're a little bit unique than in other communities. Our police officers are actually the pre-hospital emergency medical care first responders. So in some towns, that's your paid fire department. In other towns, it's volunteer fire department. Here in your town, Mark, it's your police officers. So many of our police officers are emergency medical technicians. That's actually a requirement when we hire you, that you have to obtain that advanced level medical certification within a certain period of time. So it's really important that our public safety staff is healthy and at the ready to serve.
There is obviously, I think right now, and you'd probably say you see it in your department. I mean, we see it here at work. We certainly see it in the community. I see it in my neighborhood. There's a heightened level of awareness, almost a nervousness from some people. Do you see that, and do you hear from people who feel that way?
We do, and so part of our role in public safety is to ensure people that there is a sense of normalcy. So day to day, while this horrible public health crisis is affecting our state and our nation, we're also doing the normal things, right? So police officers are still going for normal calls for service. Firefighters are still responding to automatic alarms and accidents and fires and dwellings. So the regular job of public safety goes on. And as we're doing our regular job and we're encountering the citizens that we're so proudly able to serve, we're reassuring them that we are there for them in their time of need.
It's almost a situation, too, I think, where people get a little stir crazy because they're, locked up in their houses to some extent, being told to stay there. You go for walks, you do what you can, but at the same time, you got to keep your distance. You can't go sit in a local restaurant. At some point, people are going to start to be like, I don't know what to do now. I'm kind of losing my mind.
Yeah, and I think we're going to see that evolve in California.
Yeah.
As you know, the governor of California has just recently declared a kind of a shelter-in-place order, if you will, for all the residents in that very large state, certainly larger than Connecticut. So I think we're going to see how American citizens respond to that. But here in Connecticut, we're a very resilient state. Our citizens are very proud of our parks and our beaches. We just want them to maintain social distancing when they go enjoy those things. So we still want people to go out for walks. We still want people certainly go to our restaurants for takeouts and support our local businesses. But we want them to do so responsibly and heeding the advice of not only the CDC and public health officials, but the public safety officials that are ready to serve them.
All right. Certainly good advice, Chief. Thank you.